Hi, my name is Daniela Maldonado, and I'm going to talk about soluble urokinase receptor and acute kidney injury. Definition: acute kidney injury is a common condition that affects 1 in 7 hospitalized patients. It is currently associated with the soluble urokinase plasminogen activator receptor, which is a signaling glycoprotein believed to be involved in the pathogenesis of kidney disease. Under normal conditions, its symptoms are low but may be elevated in some malignancies as well as in individuals infected with human immunodeficiency virus.
Chronic kidney disease, or CKD, describes the gradual loss of kidney function. The primary function of your kidneys is to filter your blood, to remove waste and water. However, over time, conditions like diabetes, high blood pressure, or even other diseases like autoimmune and congenital can damage the kidneys and weaken their ability to filter waste and water from your blood. Now, depending on the disease that is causing the kidney dysfunction, you may be diagnosed with conditions like diabetic nephropathy, polycystic kidney disease, hypertensive nephrosclerosis, and when we use the term CKD, it applies to all of these conditions. The two most common causes of chronic kidney disease are high blood pressure and diabetes, so people with these conditions are at risk for CKD. Other people at risk include those with a family history of renal disease and those who take a lot of painkillers, even over-the-counter products like ibuprofen. CKD tends to be a silent disease, and in the early stages of it, there are usually no symptoms. As the disease progresses, some symptoms may include changes to how often you need to urinate, feeling tired or drowsy, losing appetite, swelling in the feet and in the hands, a feeling of itchiness or numbness, nausea, vomiting, muscle cramps, and darkness of skin. Often, kidney diseases are discovered through routine testing of blood or urine. The major blood test that is performed to diagnose CKD is the serum creatinine, which estimates how well the kidneys are removing waste products. The serum creatinine, along with other factors such as age, race, and gender, are used to estimate the glomerular filtration rate, or GFR, which is a measure of kidney function. Unfortunately, there is no cure for CKD, but treatment is designed to delay the progression of the disease. There are some medications that can help slow down the progression of the disease, but the main interventions consist in controlling the underlying condition. People with reduced kidney function should see their doctors regularly to keep their blood sugar and blood pressure levels under control and avoid taking painkillers or smoking. Treatment options for patients with very low kidney function or in the end stages of CKD include dialysis and kidney transplantation.
Applications in medicine. It is a sepsis biomarker, and it's a biomarker for chronic kidney disease and kidney dysfunction. Checking their levels in patients before cardiac surgery may indicate the risk of developing acute kidney injury.
Thank you very much for your interest in our paper. My name is Dr. Xu. I am a kidney doctor and epidemiologist at the University of California, San Francisco. What we basically found in this paper is that the number of people in America with chronic kidney disease has stabilized over the last decade. Specifically, the prevalence was 6.9% in 2003, and it was also 6.9% in 2012. This stabilization was seen in all the subgroups we examined. For example, in the slide shown here, the overall temporal trend is shown in red, men are shown in blue, and women are shown in green. These are very encouraging data because we know that during the past decade, the number of people in America with diabetes or obesity or other risk factors for chronic kidney disease have actually increased. Our interpretation of this data is that treatment strategies applied by primary care physicians, nephrologists, endocrinologists, and others have really successfully prevented the development and progression of kidney disease. These include better treatment of blood pressure and better treatment of blood glucose. We think that further research is needed to identify specific strategies by which we can broaden these treatments and apply them to a larger segment of the population to really help the most number of patients. Thank you very much.
In the pros and cons, we have in the part of the pros that the clinical part is very useful as a biomarker and helps prevent diseases, especially those related to the kidney system, for example, acute kidney injury. And in the cons, we have the soluble urokinase receptor values alone do not differentiate between the three types of glomerulopathy, the focal and segmental glomerulosclerosis from other glomerulopathies causing nephrotic syndrome. And in conclusion, we have that this receptor acts through binding to the beta-3 podocyte integrin, one of the main proteins that anchors podocytes to the glomerular basement membrane. The interaction of the receptor and the integrin produces structural changes in the podocytes, altering the permeability of the glomerular filtration membrane, and the circulating levels are related to the type of kidney disease causing the nephrotic syndrome, but also with age and kidney function.